gentlemen, photographers, ladies, please sit down. And before we take questions from the floor...
Michael, I think vast majority of Canadians would agree with you that they want their universal health care, they want to hang on to it, but I think you would be hard-pressed to find Canadians who would agree that 20 to 40 minutes is sort of a standard waiting time in a Canadian hospital. And I'm just wondering why you paint the picture so universally rosy in a place like Canada when criticisms like that can undermine the credibility of your film, because the average waiting time in Canadian hospital is closer to 3, 4, sometimes even 5 hours.
Well, that's not true. With all due respect to you being a Canadian.
Well, it's several hours, let's put it that way. And from personal experience, just last month, 4 hours for an 89-year-old woman, my mother, on the, very dire condition. So, I mean, there's a lot of...
You mean you're telling me it was an emergency and you had to wait 4 hours?
Well, it was a failure of triage that they didn't catch the emergency. But basically, the waiting times are not 20 to 40 minutes. And why didn't you deal with the fact that in some of these socialized medicine situations, there is, like Canada, there is a crisis in the healthcare system because of the safety nets being disintegrated?
That's right. Well, first of all, the Canadian system, I know I hear a lot from Canadians about the long lines and whatever. The specific incident, I'm sorry that happened to your mother, but as you said, someone made a mistake at the hospital because all the studies have shown with Canadian hospitals, if it's an emergency, if you need help right away, you get the help right away. But the Canadian system, beginning with Mulroney, has been underfunded, and that's the problem. That's been the problem with it for 20 plus years. And there's not a problem, though, with the actual concept of universal health care in Canada. And if you ask most Canadians, and I would ask you, would you be willing to trade your Canadian health insurance card for our health insurance card? What would your answer be?
No.
No. That is correct. So in...
That's not the question.
No, but in spite of what happened to your mother, you still wouldn't give up what you have. And my point as an American, and I'm looking at Canada through American eyes, so again, if I were Canadian, I'd probably complain louder than you just did. But I'm not. I'm an American saying something's wrong with our system, something is right in Canada.
And I just don't understand how far would you go with your ideas, which I really respect very much, because after on Tuesday,